Welcome, Ian. Today we're making a recording for the SAPICS conference, and we're going to have a little bit of a chat around AI and logistics. But before we get started, please give me a quick 2-minute origin story. Basically, who are you, where do you come from, and what makes you you?
So my name's Iain Barton. I started my professional career as a medical doctor, but I'm fully recovered now. I spent 10 years in practicing medicine, 20 years in the business of medicine, and then the last few years in the philanthropy or non-profit space before starting Health for Development almost 2 years ago now. And what we're focused on now is two aspects. The first is the development of strategies, structures, processes, and approaches for accessing markets in Africa, in healthcare markets in Africa, for pharmaceutical companies, for NGOs, even working with governments around policy and practice. And then the second part is an impact investment fund targeting small to medium enterprises in healthcare in the delivery of clinical services and also in the delivery of commodities.
So a quick question actually around that. So you mentioned a lot of it's about the delivery of different kinds of commodities and elements within the healthcare space. And this being a logistics conference, I'm assuming it's got a lot to do with that. So a lot of the things you guys do behind the scenes is probably around then how do we move this around, what services do we use, how do we make sure we can get this effectively and cost effectively at the different places where it needs to be. That kind of hit the nail on the head?
Absolutely. Access to medicines talks about the availability, the affordability, the adequacy, the quality assurance. All of that needs us to go all the way back up the pipe, back to who's making it and what is it costing to make. And how do we get from an innovator who developed it and patented the product all the way through to a generic organization who's now making it at scale so it's more affordable. So it's the source and origin. There's the start of the supply chain. But then it's also the demand forecasting, understanding the need so that that can inform production. Understanding the procurement practices, the buying practices, and how to pool procurement across businesses, across countries, across donor programs so that you maximize price benefit on the front end. And then the actual movement of goods, the inbound logistics to the continent, the storage on continent, the downstream last mile delivery, and then the eventual dispensing of the medicines at the front end. And all of it sitting under the umbrella of quality and regulatory compliance, because there's a huge accountability for patient care.
Brilliant. You already mentioned the demand forecasting, which obviously falls within the realm of AI and the machine learning space. What other practical uses of AI have you seen within the space, and how does it affect your world?
The first place that I really saw AI having an impact was during the pandemic. And there we had big efforts being made using large language models already then, trying to understand which products might be able to be used to counter the effects of COVID. So medicines that were already in the market and were being used for other things. In all the research that had been done on those products, in their development and in their use in the market, for some of them for 40, 50 years, what was there to tell us that this could actually be effective in COVID? And that's where remdesivir came from. That's where the use of prednisone came from, is that these were drugs that were available. They weren't new drugs developed for COVID. They were drugs in the market that were repurposed for COVID based on the AI methods that were deployed onto the research knowledge base that existed.
Yeah, that's amazing. And when you said use of LLMs, my mind immediately went to maybe there was some form of, that previous versions of generative AI in terms of conversation, but now you hit or kind of described it as, well, we've got all this body of knowledge that we've developed over time and understanding. Now we're introducing new research with the COVID variant, and now we would like to explore and understand and then use these models to see, well, where are the patterns and which of these, ingredients and different drugs would then be effective in that regard. Brilliant. And then anything else as well in terms of further in the supply chain?
So the way that everybody goes is then to, okay, well, how does it engage with patients? There's a lot more benefit than that. In the supply chain structures, demand forecasting, source and origin supply management, understanding capacity on the back end versus demand on the front end, making sure that we're getting the right demand signals all the way through the supply chain and informing the trigger points. So we used to have this policy and approach that targeted the price of medicines at factory gate. What AI has already shown us is that we can get far more information by going after key starter molecules, the stuff that's used to actually initiate the chemical reaction, and look at the price changes of that to anticipate the price changes that we'll see in the market in 12, 18 months time. So and to know then whether to buy up or buy down. Mm-hmm. So there's all sorts of implication in the supply management. The really fun stuff that we're playing with and that we're starting to scratch around in is how do we use alternate means of inventory counts at the front end. It's really, really hard to get people who are really busy seeing patients all day, every day to go and count the stock on their shelf. But why can't we just get them to take a picture and let the machine tell us what that picture means in terms of stock availability? How do we get their utilization profile to tell us what their clinical competence looks like? Are they using the right drugs for the right things because their profile doesn't match the profile of other people in similar communities? How do we get the machines to tell us what is the right catalog to put in a pharmacy in that community with that economic state? How do we get the machines to tell us what price point to develop products at in order to achieve maximum uptake? How do we get to understand what a national health insurance system needs to look like in order to be cost effective, given that it has a schedule of benefits that it needs to cover and a cost base associated with those? So you start to see the potential for this in healthcare is not about how it manages a patient and how a patient gets triaged or their symptoms and helping the patient and be empowered. That's vitally important, yes. But the consequential benefits go right across the supply of products and the supply of services.
Multiple use cases in many areas. And then how do you, so that you mentioned a lot of different actually uses that could potentially be used and so forth, but I'm still going to ask the question of how do you expect that to change in the near future? Do you expect that is the only things and the only areas that you believe will be, is the most important place to have an impact that's going to be impacted by AI, or is there anything else or some more things more to it?
So I think this is a really, really important topic, is that AI is not going to change how the industry functions. It's going to change how every player within the industry functions. So AI is a tool that will be used by every one of us at every different level within the industry. Yes, there will be disruptive innovations that come where somebody says, okay, I've used AI to understand how I can completely change process. The short-term benefits are going to be about revolutionizing the way in which we do the current processes. The longer-term benefits are going to be about changing the way in which the process happens altogether.
Brilliant. And what are some of the top challenges when it comes to AI or the AI within the supply chain, what you've seen within your world up to this point?
I think the biggest challenge is the Dunning-Kruger effect. It's the current bright, shiny object. I always joke how SAPICS 5-6 years ago, if you didn't have blockchain or drones in the title of your talk, nobody came to listen, right? So those were the bright, shiny objects of the time, and everybody was clever about them, and everybody knew it was going to change the world. Today, we have very practical conversations about the effective utilization of blockchain technology and the specific niche roles for drones or unmanned avionic vehicles in a supply structure. I think the same will happen with AI. At the moment, it's everybody's a boffin. Everybody wants to talk about it all day, every day. It will become a very effective tool that changes the way in which we work and then changes the entire way in which service is delivered over time. But that's the biggest challenge at the moment, is to actually get the smoke out of the room.
There's been a massive amount of hype, I definitely agree with that. And then there's a lot of value being added, and it's kind of pulling that narrative out and just showing that and showing to people, look, yes, there's all of this, yes, there's all these great things happening, but here's the realities, here's the things we should be focusing on.